Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, ATH Alice. Welcome to our weekly show. My name is Abby. I'm your health living NP. How are you guys doing? Hope all is well. Please excuse the noise in the background. My neighbor's mowing. But anyways, how are you guys doing today? It's a beautiful day. So as you can see from the title of the show, Emergency Preparedness, what's in my first aid kit? Now, my first aid kit is going to be a little different than yours because I'm a healthcare provider. So I keep a lot bit more in there. But this is just like a basic what to have because this time of the year, there's going to be, people going out, having fun, visiting more often, going to the pool and having a good time. But also it can be applied to any time of the year. And also, May is also Stroke Awareness Month too. So, emergency wise, chest pain, heart attacks and all that. So, it's always my disclaimer. I'm a provider, but I'm not your provider. So please do not make any changes without checking with your own provider first. So please share the show. Please give me a thumbs up. Please share the show, share the show so more people can see it. Algorithm works that way too. Okay. So let's get started. So first aid kit, all right? So most people, like, I have this one, my first aid kit. Okay, you can buy in any different. I'm not endorsing any brand here. Okay, so you can have any kind. It has some information on the back there too. Everything is in it. Okay, and I also have like a bigger stuff too because I do health fair, so I have much more in there. So what's in my first aid kit, and what are you supposed to have in your first aid kit? Okay, again, there's some medications in there too, so making sure you're checking with your own provider. So first things first, as far as if somebody is unresponsive, meaning that you come upon them and they're not breathing or they're not moving around and all of that, and you shake them and they're not moving, you call 911 right away or whatever the emergency number is in your country or town or all of that. So call 911 right away, especially if you're alone. Call 911 right away, even if you're not alone. Call 911 right away. You say, Mr. Mystery, call 911 right away, and you start doing CPR right away. You don't have to put your mouth on their mouth. You don't have to sit there. Nothing. It's like, I think it's called street CPR now. You go right to the chest and start going 1 and 2 and 3 and 4 and 5. You keep going. Make sure, especially if you're alone, you have already called 911 because you get very tired after like a couple of rounds. Okay. So, and it's important that you also can go to CPR class and all that. They have the basic ones where you can go to your hospital, your local hospital, the YMCA, the health department. Some schools also have it. Places where you work, especially for those of us who work in the health field, they always have it every 2 years. Okay, they call the American Heart Association. They can give you a list of places that you can go. It's not that expensive. I think it's like maybe $75 if you're paying on your own. Okay, and it has so many discounts too. So go in there, go right away. So just remember, somebody's not responding or not like that, start CPR right away. You don't have to do mouth to mouth, just start. Because the most important thing is to get that blood back into the chest, get back into the heart and back into the brain, because you want to prevent further damage. Times equals tissue. Okay. Time equals tissue. Just remember that you want to save the tissue. You want to save their brain tissue. You want to save your heart tissue. Okay. So if somebody's having a stroke, let's say you come upon them, all right, and you see the acronym, it used to be FAST, but now it's be fast. All right. So you look at balance, you see them walking kind of funny. You'd be like, this is not the way they used to walk before. So look for that. Look at the eyes. You see like, bulging, or like you see the eyes are uneven and all. Face, look for the facial drooping, like one side of the face will be kind of down from the other side, especially if there's somebody who hadn't had a stroke before and it looked different. Even if they had a stroke before, sometimes they may be having another stroke already. The arms, the sudden weakness, they'd be like, oh my God, I can't move my arms, I can't move my legs all of a sudden. And it's usually one side. It's like, this is not normal for me. Alrighty. The speech is to start talking and they're talking slowly, and this is not the way they talk. People like me who talk fast and all, and I'm trying to, learning how to talk slow, but you hear, slur speech and they're having difficulty getting the words out. You're like, why are you talking like that? All right. And then time, call 911 again, call 911. They're going to ask you, when was the last well time? But because the public people, so they imagine they're just going to ask you, when's the last time you saw them when they were their regular self? Remember, it's like 3 hours before they can give the medication that can, if they have a clot in their brain, that it can open that bust that clot and get the blood flowing again. There's so many different kind of strokes and all that. So make sure, you have to have the medication, and if they're getting blood thinners and all. So it's important. Remember, balance the eyes, the face, arms and your limbs and all, speech and time. So it's very important. Time equals tissue. The person's complaining of chest pain. Sometimes women, it's just like a little bit, I have a little bit of indigestion. I feel it go into my neck and back. Sometimes it's not the typical just, oh my God, my heart. But of course, if you see that, call 911 right away. Alrighty. So, but outside of those emergencies and all that, and somebody's choking, of course, you have to do rescue breathing. They used to call Heimlich maneuver. It's called rescue breathing now. So make sure you learn that. So it's important that you do go to CPR class, do first aid, at least have basic first aid. Okay. So outside of that, what do I have in my first aid kit? Okay, so first of all, you want to have some water already, not necessarily sterile water or the spring water, because if the person got cut and all that, and you may have to like wash the area a little bit, they'll tell you it's like basic things you're doing at home now. If it's something more than that, then you're going to be calling 911, and they kind of run you through it. All right, so you just have some water close by. Have that water in the kit there too. Okay, or just have some water close by. Most people have water close by, or you can just dip water from the sink and just kind of rinse it out. You don't necessarily have to have this kind. All right, and antibacterial, so we can kind of wipe the area too. So sometimes when you're taking care of the patient, the person, you want the place clean, and just gotta keep the place clean, because if the person's got a cut or any kind of wound, or you don't want to get infected. Okay, and also let me get my stuff here. I have my, okay, in case if the person's coughing and things like that, and you don't want to get in your face, and just to be on the safe side, you have your gloves. So you get your gloves, but you can have your mask. Always have this. I know we don't have to do it anymore, but let me just turn this off for a second here. Okay. So you can have your mask. Remember your mask. The mask comes like this. The metal part is here. So this goes over here, and you pinch that down, and then you put that over your ears, and make sure your nose and mouth are covered. Okay. So in case the person's coughing, or just sometimes you don't want to be in their face also. So you keeping them safe. Alrighty. And always have a pack of gloves. Okay. You put your gloves on, because you get, and of course you'll be doing this real quick too. You put your gloves on real quick, and then you start grabbing everything. If you have to have them little cuts here and there, or the person's vomiting and things like that, you want to have your gloves so you're not coming in contact. Alrighty. So 1 second here. I'm just gonna turn this off. Okay, sorry. And you have your glove. All right. So these are disposable gloves, so you're not using them again. Okay. So when you're taking them off, making sure you go in like that, your finger's still there. You take your dirty part, you do that, and then you take your clean finger. I'm sorry, and then you go underneath here, and you get rid of that. So you're not touching that, and you get rid of that after everything is done. Okay, so usually alcohol. Remember when little back home they used to take the alcohol and just kind of pour it right in the wound. Don't do that. All right, talk first. And usually it's like an antiseptic stuff, or you can use that. It doesn't burn, especially for little kids. You can just clean out the wound. And certain kind of wounds you don't need to use that. They'll tell you what kind of cleanser to use to. Okay, so you just kind of rinse it out there, dab it dry. Alrighty, and also for gauze, let's say if they're bleeding, or you want to cover it up before you take them to the urgent care, or let's say they don't really have to go to urgent care or to emergency room. This is the gauze. They'll tell you to have any gauze. Press that there. Try to keep the compression there to stop the bleeding. Of course, you're gonna have you're gonna have different sizes. I have different sizes too. Okay, so you keep that there and make sure you want to stop the bleeding. So keep your hand in the area and stop the bleeding. Keep the arm above the heart area, so you can stop the bleeding. Okay, at this point, everybody try to keep calm. Okay, now let's So, and if you have to record anything, especially if the person's having a stroke or something like that, have somebody saying, because I always say that when we do that at work too, who's recording? Okay, yes, we came and met mom laying down there. What time did we come in? What time was it? It doesn't necessarily have to be like the exact time. Like it was like 5:14, or no, I walked in the house around 5 o'clock when I came from work, and I think this show was on, and what time that show was on. And that's when you kind of have an idea, because you want to have that window so they can know that, you didn't see mom at 1 o'clock and you came in 7 o'clock, and then she, that would be way outside the window. So make sure you keep calm, and somebody can be writing things down. Okay. And if you have to put in a band-aid, make sure you have your band-aid. You have the cute little ones we have the regular ones. All right. And you can put that if it's like a little cut. And then we have the little The one for little kids. Sorry. They have the little ones. They love that. The little color ones, pretty. See how it looks like. So other little kids, when they have that, when you're having your cookout and things like that this year, just all of that, just have that and in place. And most people will have like a family member who's in healthcare anyway. So if you don't necessarily have to do that. So that's why it's important to do a first aid class. But always just have that. Okay. And little ones that love stickies, have some stickies too. Because little kids will start screaming for like the littlest wound. But if you clean the area run nicely and you put a little sticky there and a colorful band-aid, trust me, that will kind of keep them calm, because it also, when they're panicking, that can also cause other people to panic. And then something that's kind of minor can become really bad. Or even if it's really, like really, really major, that's still everybody's keeping calm and you keeping the kids calm. Or like a person who's anxious, because we have some adults who are really anxious too when emergency happens. So because it's an emergency, you never know how you're going to react at an emergency. Okay, so just try to keep calm and keep one person calm. The ones who like really going to go off, say, keep them away from the emergency, because they'll be like, oh my God, I see it. No, they say, you know what, sit over there. And that doesn't mean you weren't there to help your relative. It just means that certain things that you cannot control. All right. If they're complaining, if there's less like a broken bone and stuff like that, so you want to use the rice method. You rest. That was also after the emergency. You rest. You want to put the ice pack. Most of these you just kind of break it up and open up and it become cold. I have some ice pack in my refrigerator, in my freezer also, so I can just grab it from there and just put it in there. If they tell you you probably have to cover the area or just kind of tighten to do a tourniquet, you have your little stuff. You just wrap the arm up like that. Okay, you've been nice, a little nicer than that, but at that point you'd be panicking anyways. And then you elevate, what is the arm or the leg, elevated. Always want to make sure it's elevated and wait for the paramedics to come. Of course, if that's the case, you're going to be calling. Don't let that person move around. Don't let that person hop on the leg that's broken. Don't do that, because you don't want that to completely break. Okay, if it's like a minor break or something like that. Alrighty. Also have like nurses scissors, the safety scissors. All right, you see the ends here kind of dull. Sorry, it's not showing because right here. Oh, there you go. Alrighty. So if you have to cut anything, because little kids, you have to cut a little bit of gauze and they don't want anything hanging. When you're working with kids, it's a little different. And also some elderly people too, you want to make it nice. And also some for people like me, like you'd be like little OCD-ish. I'm like, hey, you can just cut a little bit there. Or if you just have to cut a band-aid or things like that. Okay. And it might ask you what's your temperature. They have the thermometer now where you can just go right to the head and get the thermometer, so you don't have to, get the temperature already. So anything greater than like 100.4, and especially with kids, anything greater than like 100. So you call in the paramedics or you call in your doctor's office. They'll be asking you for that. All right. Or have that. This comes with covers. You can just put a little plastic cover over it. If you can't find it, just grab a little piece of plastic and make sure you take it out when you take it out of the mouth, so the plastic is not in the mouth. You put that under the tongue. You keep it there for a little bit and you press the button, and then it reads the temperature and you can get that. Also, at this time, you're going to have your little notepad. Where did I put my notepad? You have your little notepad, okay? And you're going to be writing this down. Okay, this happened this time, and this is what happened. You write the temperature. They'll tell you, look in what's the breathing, to this, because they're going to tell you what the respirations and all. Usually they won't be asking regular people that. If they're in healthcare, you can just sit there and look at the person breathing. You'll be like, oh my God, they're breathing really heavy. They're breathing really heavy. They're breathing. Then we don't care. It's like, okay, yes, okay, bring that person to the emergency room. Okay, there's also, you want to have a blood pressure cuff. All right, this is the one where you have to have your stethoscope and okay. I didn't put it all together. And all of that, that's too much. Who has time to be figuring that out? If you had the automatic one, okay, this is adjustable. You can just put that on the arm. All right, you go in here. Sorry, put that in the arm. You can put it in the forearm. I got to remember to stay here. You can put it in the forearm, or you can put that in the upper arm. All right, remember to stay here. Okay, in the upper arm, I have to go a little bit higher than that. You press the button, keep that over here, relax. Don't be talking too much when they're trying to get your blood pressure and the number come there. They'll tell you what's the top number, what's the bottom number, okay? You tell them, this is over this, 140 over 90 or 140/90. They know what the number, the person you be talking to, they know what the numbers mean, okay? So you have that. Now you could be saying, oh my God, I don't think I want to have, to put that thing in and all that. You can have the one, it's a wrist one. You just sit there, put that right on the arm, right there. Okay. You press the button. and then it goes right there, and you get the number again. The person who you're going to be talking to knows what the number is. Write that down on a piece of paper. Alrighty. And you can also press the button there, and it tells you what the number was in case if you forgot. Okay. It comes with a charger too, so you can always charge it. Now you say, well, how would I know of an emergency and stuff like that? If all else fails and you didn't charge it for a long time and the emergency showed up, doesn't matter. They're just going to take them. All right. And you don't have to know all that. But this is just like if you're home and you're calling the doctor. And also for people who take blood pressure medications, also they might say, don't take your blood pressure medicine if your blood pressure is lower than this. So you're teaching them how to do that too. You just put it on the morning, and you said my blood pressure is like, it was like, 95 over 60 or so. They might say, don't take the medication because of that. Okay. So at least you have that. And also if your blood pressure is low and you're getting dizzy, or the blood pressure is really high and you're supposed to take a certain amount of medication, but the blood pressure is so high this morning, you might call and say, I know my blood pressure usually runs around here, but it's really high this morning. And and I just want to know, they'll ask you if you're having a headache, any dizziness, any chest pain. So your doctor knows your history and all that. So they can go and walk you through whether they want you to go to the emergency room or just take an extra pill. But based on your history, your doctor wouldn't know that. Okay. Also, like I said, the gauze too. This one kind of sticky, so if you have to rub it and if you have to put it on the arm to like make sure for to wrap the arm. You see how when people have bandage around the arm and all that too, to compress the area. So you can have that. You're supposed to have some ibuprofen or acetaminophen. I'm not calling the brand names in your stuff there. Again, follow up with your doctor because not everybody can take those. Alrighty. And if you got a little bit of pain, aching joints or stuff like that, aspartame, you just rub that there. It's like, in library, it's kind of like koto, I think koto, yeah. Or, just put that there. That's supposed to help with the inflammation. And what else do I have? You can have some alcohol swabs. It's small already. So in case you're doing blood sugar or you just want to wipe the area to cleanse the area for a little bit. Again, don't put that in an open wound. You can have that there as well. And triple antibiotic ointment. Of course, again, these things expire after a certain time too. So every 3 months or so, kind of look at your first aid kit and see what you have there and see what needs to be taken out. I think I went over everything. So most important thing, and also, what are you supposed to have in your medical information that you're supposed to have? Okay, so let me just go in there and when you're watching this later on, if you have to see the things that I'm putting there, you just pause and just watch. Okay. So in your first aid kit, you're gonna have your little notepad. All right, and something like that closes up too, so that way it's not. So you want to have your full name. All right. So if it's a family member, always have that there and have it ready to go. Your full name, the birthday. So if you're talking to your younger kids too, so they can know their parents' birthday, because some kids don't know their parents' birthday or their parents' age, but we can pretty much kind of figure out, okay, if you have children this age or you were in school around this time, this will be your birthday. All right, because you may not be able to speak at the time. All right, your current medications. All right, look, all your medications that you're taking. Don't say I take my high blood pressure pill and I take. I mean, if you say that, you really can remember. You know the blood pressure pills that you're taking. Know the medications you're taking for your thyroid. Know the medications you're taking for diabetes. Where you keeping those medications and all that. So have that. Know the dosage, the instructions, and all. Okay, because you could be taking. Somebody might say, "Oh, you're taking a whole lot of a whole lot of blood pressure medicine, or this dose is pretty high." So that means we're surmising that your blood pressure is not controlled yet. So that's why your dose is a little high, or maybe you may have some heart events that may have caused your doctor to say, okay, let's change some medications around. Remember, you can be on different kind of blood pressure medicine and they all do and something different. Okay, you can also be on combination blood pressure medicine too. So don't say, oh my god, why do they have you on so many blood pressure medicine? I would just put one aside and I won't be taking that. No, there's a reason why you're on different kind of blood pressure medicine. Okay, and then of course, don't ever stop your medications unless you speak to your doctor first. All right. Your allergies, you want to and list all the ones that if they tell you, oh, I can't have shrimp, what happens if you have shrimp? Oh, you can say, yeah, sometimes I don't know. Not if you don't like it. What happens if you have shrimp? Does your tongue swell up, your throat swell up? Do you feel like you're gonna pass out and like they had to give you epinephrine shot? Also have your EpiPen in your thing too, okay, and have that one with you and then one in the house somewhere where everybody can reach it. Practice how to use it also. Okay, so that's a serious allergy. The other one may be like, oh, sometimes I get a little bit of rash here. They'd be like, okay, Not when there's serious allergy, but it's not as serious as the one where if we give you this medication, you could pass out. All right. If you're having chest pain or stuff like that, the first thing they're going to start saying, okay, let's get this aspirin into you. Let's get this into you. Maybe allergic to aspirin too. So make sure you put that there. Okay. Also the gloves. Some of the gloves, you have the gloves in your house. Get the one that says that is latex free, because some people could be allergic to it too. And then when the paramedics come as well, most of the time they have latex free gloves now, so they can be touching you. And even some of the gloves, they have that powder in there, and that can also cause you to get a rash. So try to get a one that's latex free. Okay. Make sure you list all the medication, all your medical history too. So most of the time I tell people have all this information in like a little binder, and everybody has access to it. So now there may be some diseases that you don't want people to know that you have, and there's nothing, totally fine. If it doesn't affect the emergency and all that, that's totally fine. Okay. So if you have high blood pressure, if you have diabetes, if you have like a seizure history, if you have anything like and autoimmune diseases, all of that, make sure you have that. And you can say, I have high blood pressure, and you list the medications next to it. I have this, and list the medications next to it and all that. Okay. You can have that in the secret thing in your phone also. Print it out, have it there, or you can, another family member can be like, just look at it. And always remember, if you go to the hospital and you come back home, they may have changed some of your medications when you went to the hospital. So that's why it's important when you come home that you make an appointment to see your primary care doctor, so they can change some of your medications around, or they can change the medications according to what happened when you went to the hospital, because you don't want to be taking the same dosage that you were taking at home. Because some people might say, I don't have any money to buy new medications, and they change this around and all of that. It doesn't mean that, okay, we don't want you to say and then going broke, because healthcare also can, is one of the main reasons why people file bankruptcy. Alrighty. So you can talk to your doctor and you say, okay, what can I take instead of that? How can I, the same effect that that drug would have, but what can I take something that's a little bit cheaper? Because, we all going through things in life, and all. Some people can afford it and some people cannot afford it. And medication can be very expensive, especially something where you have some disease that it require you to get these medications that are very expensive. So it's important that you can talk to your doctor about that. They also have social workers too. Some doctors have their primary care offices have social workers right there, and they can talk to you. They can give you so many different options and places that you can go. If you can get it online, if you can get it in bulk for 3 months, there's so many ways that you can get it that can be cheaper. Okay. And if you have dialysis, if let's say if you're taking dialysis at home, make sure you dial in right away. Of course, if hopefully you'll be there with somebody. I have my access in my arm. The way you have your fistula, I have my access in my arm. You cannot do it in blood pressure in the arm. You cannot do it in blood work in the arm. I have my access in my chest and all that too. So please make sure when you're reaching for my clothes that you're not grabbing something like that, because it's nicely stationary, but there's always a chance that they may reach over and pull it out. Okay. So let them know that. When was the last you had dialysis? When's the last time you had your dialysis treatment? People could go Tuesday, Thursdays, and Saturdays, Monday, Wednesday, and Friday, or maybe if you're new, they might be doing 3 days in a row. Most of the time, if it's 3 days in a row, that means you're in the hospital, and it will get that all settled. Okay. So have all that information in there. Have your next of kin, the person who is supposed to call to get the information, who's going to make decisions on your behalf if you can no longer make them. That's why it's important while you're still with it, you make sure you have a living will that you call. You say, if anything should happen to me, my medical power of attorney, this person could be doing that. Remember that there's financial power of attorney and medical power of attorney. So yeah, this person on my phone, I have on there the person's name that I'm supposed to call, and it's like ice. Okay, not that ice. In case of an emergency. So that person name is right there in case of an emergency. Like, I don't know about the other phones, but Apple have like your, favorites. So you can have the people who you want listed, but the main person should be like the person to call in case of an emergency. That person kind of knows a lot, more about you. And they may not really know, but you trust them that they'll make decisions on your behalf, and let them know that. And we're also in the age now where most people won't answer the phone if they see a strange call. So let that person know that you're the emergency person. Okay. And then just say, okay, oh, they want to know this about me, or I keep all my information here, or I'm going to text this to you, so just in case, and all of that. All right. It's not going to be pretty, because the first time around it's not going to be pretty, but I talked to you about the basic stuff we do at home, and then in case if you have to go. So bottom line is, try to go to a first aid class. Okay. Go there, go to, you can get that at your local hospital. They have it over at the YMCA, they have it over at health department. um Also have all your different things in your kit there. Have your water, have your hand sanitizer. I didn't put hand sanitizer. Have your glove. This is disposable, so you have to get rid of it when you're done. Have all of that. The person takes insulin, where to keep their needles, and all those things are very important that you put them there, and make sure you know the person's history. So in case of any kind of emergency that happens, on your on your list of things, don't put your social security number, because God forbid that gets missing somewhere, then you put yourself at risk for theft and all, identity theft. So make sure you don't put that there. For little kids, know to teach your little kids how to call 911. All right, call 911. And what's going on? What's going on? My mommy's not waking up. Shake your mommy. What's your mommy's name? Most kids say my mommy name is mommy. Nope. Start teaching them. My mommy name is, Abigail Tyler. All right. My mommy name is John. My father name is John Brown. Don't, so I know it's like sometimes they very little don't understand that. If your kids have issues with seizures and things like that, teach everybody in the house to be responsible for that. I know some kids might be like, I don't want to be responsible. I got my own thing to worry about, but we're all family. We have to know those things. Okay. If you have kids that have some learning disability or intellectual disability or any kind of emergency, they may get scared. They might run and go hide somewhere. And especially in kids of fire and things like that, you want to grab them, tell them, come with me. Don't go hiding, because if they go hiding, they're thinking that even with kids without intellectual disabilities, they might think, oh my God, the fire will stop. The fire won't get me if I'm hiding somewhere. And that can be very scary. So grab them, know your codes and all that. Family emergency, know your codes and all. Okay, we're gonna meet outside. We're gonna run outside. We're gonna count where everybody is. Just run out the door. Don't just go out the door. Don't worry about the cat. Don't worry about the dog. Just go out the door all the way outside. We're gonna meet at the tree and stay there. Stay there. Okay. If you don't see me, get out the door. All right. Yell for everybody, but get out the door. Get out as soon as possible. Okay. So I think I covered all, and I don't like to have everything long. This is not an comprehensive list. There's so much more. Some people may have a whole lot more in the first aid kit. Some people may have a whole lot less, or depending on all that too. So talk to your doctor, talk to your social worker, talk to people in there, your friends and family members who are in healthcare, and say, what should I have in my first aid kit? And make sure everybody knows where you're keeping it. You could have one or two. You could have one, if let's say if you're upstairs or downstairs, sometimes in the basement, you can have one on each floor. You can have one. You don't put it in the room where it's locked. You say, I'm putting my room and I lock my door. Well, how's that going to help people if they need it? So, but keep it out of the reach of children. Keep it out of the reach of children, because remember, you're going to have medications in there. And even the ice pack, you don't want them breaking that open, because they might think that's something sweet to eat. So make sure you keep it out of the reach of children, even though you want to teach them about emergencies, but there's certain things that they shouldn't come in contact with. Okay. So let me see here. I think I talked. Let me see my comments here. Okay. So this person said father son. Okay. So basically, just to finish up, and also do your first aid. It's good to go to first aid class. And just remember, if you come up to the person and the person is not breathing, the person is not responding verbally, or that you shake them and not doing that, make sure you get them, you call 911 right away. Start with the compression. It used to be ABC, where you check for airway, breathing, circulation, and all that too. It's a first thing, circulation. So compression, you want to get that blood going. Times equals tissue. All right. If you didn't hear anything I said today, times equals tissue. So you want to get them, you want to keep them, that blood flowing. So when they finally get to the hospital in a timely manner, so they can, if they have to take them to the operating room, they're there right away. They have to take them to get their imaging, the CAT scan and all, to see if there's anything that they can do. They're ready to go. Okay. Remember that 3-hour window there, all of that, they have to go. They have to actually, when was the last time you saw them? All right. Oh, the last time I saw my friend, or the last time I saw my brother or my husband, they were doing this. So we know that, meaning that they were doing their own thing. If you saw them 3 hours ago, they were sleeping, that's not really because something could have been happening 3 hours ago. So the last time you saw them being their regular self. All righty. And chest pain and all, call 911 right away. Don't have that person drive. Do not drive that person yourself, because you're going to stop at red light. Anything could happen. And that person, they got a little blood vessel, it's just, a little clot in there, and it's closing up, and you have like times equals tissue. Okay. So try to do that. All right. Let me see if I have any more questions. Okay. I think. Oh, that would help people. Glasses. Make sure you go to your doctor's, your eye doctor, once a year. Okay, or as often. Great topic for this time of the year. Yes. Thank you, Jackie. And for any time of the year too, because emergencies, the thing about emergencies, You don't take time, but this time of the year when we're outside and all that too. So when you go into your cookout and you're dancing, you're having a good time and you're swimming and all of that, please make sure if you have a pool, please make sure you keeping an eye on the kids. Please, and for family members who are not really good swimmers, have your little swimming things on. Don't let people tease you that you can't swim and all. If you go into the shore, please do not go swimming after hours. Follow the lifeguard instructions. Sometimes some younger kids and teenagers want to go out and have a good time. Please don't drink and drive. Don't go swimming when it's too late, because that current, you see the water is like kind of still, but don't think there's like deadly current underneath there. Don't go to the little lakes and all of that. All of that can be very, very scary. Okay. So, and always have your phone, have your phone too, because most people don't have their landline, so to call for emergencies. And most phone numbers too, they have that. Okay. So let me just see here. Sorry, I'm sorry. I'm turn this off for a second. So let me see if there's any more questions. Oh, Michael Hines, thanks for the advice, Mr. Heavy. Always enjoy the content. Thank you so much for your love and support. You're always there from the beginning. Alrighty, so sorry I talked too long, but you can leave your comments and questions below, and I'll answer them. And again, Facebook is kind of erasing, taking off all these live videos, but if they take this one off in about 30 days, it's on YouTube also, so I would just put it underneath there. Okay. So thank you all for your love and support. Please stay safe. Enjoy the day. Enjoy the rest of the week. And I'll probably come back on to have a special show on Thursday or Friday. Okay. So keep an eye out for that. Alrighty. Bye bye now.